Dr. Villacastín is the head of the arrhythmia unit of Hospital Clínico San Carlos in Madrid. Thank you.
Thank you very much, Javier. Thank you. I would like to thank the organizers for inviting me to be here to share with you this very interesting symposium. So I am going to repeat some of the concepts that Dr. Both has mentioned, but let me show you some other things. For example, why are we talking about cardiovascular? Well, first of all, because it's the responsible of 41% of all deaths. In addition, it's affecting, or these diseases are affecting to 22% of our population, and they are responsible of 14% of healthcare spendings. So it's clear that it's too much, but in addition, with an increasing life expectancy, we can observe that in 2024 and 25, more than 20% of the population will be aged more than 65. So it's easy to figure out what is going to happen in the next future. Well, this is a normal ECG. Still, electrocardiogram is very important at the time of diagnosing and treating patients. I say that this is normal, but if you get a thrombus into a coronary artery, in your coronary artery, you can develop this other completely different electrogram. That means that you have ventricular fibrillation. So the heart is not beating anymore. It's failing to impulse the blood ahead. So you are going to die. You are going to die in several minutes. Look at this slide. Unless that you receive an electrical shock, you are going to die. But you have to receive this electrical shock in less than 1 minute if you have to have a survival, a percentage of near 100% of survival. But as usually occurs, you need more time to receive the electrical shock. For example, we can talk between 2 and 7 minutes. That is the standard time. If you are lucky and some semi-automatic electrical defibrillator is close to you when you suffer the cardiac arrest, the probabilities of survival are around 50%. If the time is between 8 and 15 minutes, like happens when sudden death or cardiac arrest occurs at home, and the emergency unit is close to your house, the probabilities of surviving are lower than 10%. So this is very important. But is frequent sudden death? Well, sudden death is the second cause of death after all cancers together. So we have to recognize that is frequent. But which is the etiology? The main problem is coronary artery disease. And we have to prevent coronary artery disease. Modifying our style of life, you know how to do that. In 15% of the cases, the responsible are cardiomyopathies, and in 5% other strange causes. But how can we know the patients or the people prone to develop cardiac arrest? Well, we know, for example, very well that a reduced left ventricular ejection fraction remains the single most important risk factor for overall mortality and sudden cardiac death. Look at the right panel. This failing heart, because probably he has suffered several myocardial infarctions. So in the left panel, a normal heart. But what can we do? We have a lot of studies in which we can observe that implanting devices to patients with poor left ventricular ejection fraction, we are going to improve survival. For example, and it's very well known that if we have a patient with a previous myocardial infarction, with a left ventricular ejection fraction lower than 35%, with a poor functional class, if we implant a defibrillator, is going to live more the patient. And how can we do that? It's so easy like that. It's a small device that can be connected to the heart by means of a thin cable. So the device is able to detect cardiac rhythm, and we can even to program it in order to recognize more and more arrhythmias as we want. Okay, once that we have implanted under the skin, sorry about the images, about the blood, I know that you are engineers. So look at the ECG. We have to check the device, so we are going to induce ventricular fibrillation. Okay, in this case we are trying, we can't, but we are going to try again. And in this case, we will be lucky and probably will get ventricular fibrillation. Let's try. This is alternate current, and now the heart is fibrillating. The patient is going to die, but the defibrillator is recognizing the arrhythmia and is going to shock, and we recover, or the patient recovers, in this case, sinus rhythm. But what is the problem that we have to deal with? The problem is that in the best of the cases, when we have very, very selected population, we have to implant at least 10, 20 defibrillators in order to save one life during a period of 3-5 years. And I would like to remind you that each one costs about 20,000 euros, even more. Well, Medtronic is cheaper, and they are very good. So, but look at that. How can we to select patients? This is our problem. Well, the question is, who is going to have a cardiac arrest? And looking at this slide, we can think about that. If we look at the total numbers of people who dies or who die due to cardiac arrest, we observe that the majority of them, because we can calculate in the United States about 350,000 of people who die due to sudden death each year, about 300,000 are going to be included in the healthy normal population, healthy adult population, no previous signs of cardiovascular problems. And despite having a very, very low risk, because if we are talking about our risk, we have to recognize that it's relatively low, talking about sudden death. On the opposite, on the contrary, we can find that patients with a previous cardiac arrest have higher risk of repeat the symptom, the event, about 30% per year. But the total number of these patients is really small because these patients are only a few. So the problem is that we have to deal with the general population. So how can we do that? We need wearable or implantable devices in order to monitoring arrhythmias, heart rate related to the physical activity, for example, heart rate variability, intrathoracic impedance, right ventricular or left ventricular pressures, everything. But look at the ECG, for example. If I am recording this in a patient, that can be a very alarming symptom or sign in this case, because it's a non-sustained ventricular tachycardia, really fast ventricular tachycardia. Probably this patient is going to die unless that we do something. So we need recordings of the heart. Talking about atrial fibrillation, what atrial fibrillation means that the atrium, the upper part of the heart, is beating irregularly. So the blood is not running, so you can have clots in your left atrium. And only looking at that, we can prevent